Hi, this is Jillian from Body Labs Yoga. One of the most common complaints that I hear from some of my students is neck pain and tension coming up from the shoulders and then radiating up onto the back of the head and even into the jaw and temples. Super, super common. Now, what we need to understand when we're going into some of the movement practices is that the skeletal structure of the spine is actually very different depending upon location that we're talking about, okay? So the upper spine here is called the cervical spine, and then we've got the thoracic spine, which is where the ribs attach onto the vertebrae, and then we've got the lumbar spine down here. Now, if you look here at the vertebrae in Stan's skeleton here, we can see that at the cervical spine, there is quite a bit of space actually between those spinous processes on the back side of his neck. And so you can imagine that if he were to draw his head back and look upwards, what would happen is that these spinous processes would move together, okay? Does that make sense? That as he arches his head back, these are going to move towards one another, and that space will close. Now you can imagine that there's a little bit more potential for extension of his neck than, say, in an area like the thoracic vertebrae here, where the spinous processes are almost touching one another already, just in anatomical alignment, okay? So although we have anterior flexion available to us in our entire spine, the extension, that moving backwards, varies drastically depending upon that location of each vertebrae, okay? So we're going to talk a little bit about some of that movement potential that we've got. But as we look at the neck here, I want you to also notice that the neck has this wonderful ability for us to turn our heads, okay? Now, most of that movement is actually going to come from what's called C1 and C2, okay? So C1 and C2 are these beautiful vertebrae that are very specific to their function and very, very different in form from the rest of the vertebrae in the spine. So what happens is C1, our very first vertebrae in the neck at the top here, is just like a circular disc, okay? There's not a whole lot of bony protrusions coming off of it. It's pretty much a circular disc. So it's got a hole in the middle where the spinal cord travels through. And then the skull just kind of rests on top of that C1 vertebrae. Now C2 vertebrae is different in itself, that it starts to resemble the rest of these cervical vertebrae and has a spinous process out the back. However, it has this protrusion that goes up and through that canal in C1, okay? And so they're kind of hooked like this. And what happens is C1, which has this lovely nickname of being the atlas, and C2 has the beautiful nickname of being the axis, okay? And so they work together to allow us a little bit more rotation than what we would have if we didn't have that set up in our bony skeleton, okay? So they are very individual in that sense. Now, remembering that we've got a bunch of different muscles, we're not going to get into specific muscles here today, but muscles that are coming up from the back and attaching onto this bony crest at the back of the head called the nuchal crest, or nuchal line as well. So those muscles are coming up, and then we've got some muscles that come down onto the front side of the body here, like these ones right here on myself. And these muscles here start to assist with balancing out the forces from those big muscles on the back to bringing the head forward, okay? So that's some of the things that I just want you to understand for our foundations of our movement. Okay, so I just wanted to offer, now that you've kind of got that foundational understanding of what kind of things look like underneath this soft tissue, to an extent, there's certainly a lot more going on there. What I want you to just, okay, so now that we kind of have a little bit of an understanding of what things look like through the neck, underneath some of our soft tissues, I just wanted to offer you a couple of movement suggestions, ideas to play with that are really gentle and really quite subtle. So take a moment to just really listen in to what it is that you are feeling within these tissues and within this area that is really instrumental to our movement every day in every way. Okay, so what I'm going to ask you to do is just to find a comfortable position. In a seated position, most likely, is going to be the best here for us. So we're going to stack the shoulders over top of your pelvis as much as possible. So resist that temptation to lean forward. Now, I always like to say reaching through the tips of your ears. So if I were to say the cue to reach through the crown of your head, what does that feel like for you? Versus reaching through the tips of your ears. Does that translate differently for you? For some of us, it will. All right, and then I'm going to ask you to bring your awareness into the space around your neck, the tops of the shoulders, and the back of your head. Just noticing into that area. And let's gently bring the chin down towards the chest here and just notice your flexion forward. That's what we call this movement. This is flexion of the spine. And so we're going to keep the shoulders over top of the hips here so that we are focusing into the cervical spine. And then we're going to bring our head back up, reach through the tips of the ears. And now as you bring your head back, I want you to resist that temptation to just drop the head back, okay? So there's a difference between bringing your gaze up and dropping the head back and bringing your awareness into the tip of your chin here. And lift the tip of your chin up towards the ceiling. And how does that feel for you? So it's not about dropping the head back, but lifting the tip of your chin up towards the ceiling. And then let's bring that back down. Let's draw the chin back down towards the chest. And then bring it back up. So again, reaching through the tips of your ears. This time I'm going to ask you to take your hand onto the back of your neck here. And just your 4 fingers or even 3 of your fingers, placing them just gently on the back of your neck here. And let's see if we can maintain that space between the fingers. So I don't want your hand to start to squish together as you draw your head back. So we're going to maintain that length through the back of the neck, lifting your chin up towards the ceiling. How much difference does that feel than if you were to release your hand and allow your head to come back? All right. So do you feel that bony compression through the back of your neck as you start to drop the head back, as opposed to keeping that length there? Maybe, maybe not. All right, like I said, we have this lovely ability to turn from side to side. So just take a moment and notice how that feels for you. Okay, now this time we're going to take the block, or if you don't have a block nearby, you can take a book, a hard-covered book. And I'm just going to ask you to take your block up overhead, and then we're going to bend through the elbows so that your block comes onto the back of your head here, okay? Now what I'm going to ask you to do is to imagine that you're trying to draw your chin back, trying to make as many double or triple chins that you are capable of making here, while not allowing the block to move behind you. So your hands are going to create this resistance pushing forward while your head is pushing back, okay? So keep the length through the tips of the ears. And then we're just going to gently begin to push your head in towards that block. Now notice if your elbows want to flare out wide, see if you can draw them in a little bit. So we're focusing a little bit into those shoulder muscles as well here. Keep pushing your head back into that block. And then whenever you're ready, we're going to release that. Just notice how that feels for you. All right. And then last one, let's focus into the front side of the neck here. What I'm going to ask you to do is to take your hands on either side here of your neck. And we're just going to gently begin to create some tension on this tissue on the front side of the neck and pulling it downwards, and really gently here because there's not a lot of protective structures in this area. So really just being mindful of what works for you here. Now, once you begin to pin that tissue down towards your collarbone, I'm going to ask you to jut your chin forward. And then we're going to lift the chin upwards slightly. Now, for some of us, this starts to really radiate up in towards the jaw and the ear. That's because one of the muscles that we've got here is called the sternocleidomastoid. And what it does is it travels up from the clavicle up to the jaw joint here and then back down, okay? And so it's a really integral muscle for the front side of the neck. And so the fascia around it can become quite tense for a lot of us, especially if we tend to clench our jaws. And then let's release that down. And let's do the other side. So again, we're just going to gently draw that tissue down, pin it down towards the collarbone, jut your chin forward, and then maybe gently lifting your chin upwards. And whenever you're ready, bring it back down and release that out. All right, I hope that felt good. That's your neck reset for today.